Knock, knock, I'm coming in. I have washed my hands. This is my son, Tristan. He is 8 years old. I give consent for him to be in this video, to be on YouTube. So I'm gonna sit down in front of you, Tristan. And I am going to look at your hands first, okay? We're gonna be looking at your joints and everything today. Let's get up here some. All right. So to start with, we're always going to start with inspection. We're gonna be looking for any swelling, any deformities, any nodules, any redness, anything like that, anything that's not symmetric bilaterally. So we are going to start with the distal and proximal interphalangeal joints on both sides. And then we are going to move to the metacarpophalangeal joints. And then we can palpate the metacarpals and the carpals. And then I'm going to have you do some range of motion, so make a fist for me on both hands. Okay, and then flex your fingers, extend your fingers. Okay, and then as a provider, I'm going to do passive range of motion as well, which means I'm just going to do it for him. Do that. Put your fingers together. There. Now extend your fingers. Good. Do you have any pain when we do that?
Mm-hmm.
Okay. So looking at the wrists as well, inspecting for the same redness, nodules, asymmetry. I'm going to have you take your wrists and go like this. Can you turn them that way with it? Let me do it first. Okay, now you do it. Okay, and now we're going to go this way with them. Keep your arms straight. Okay, there you go. All right, good. Range of motion is good there. And then I'm going to have you flip over like this. And can you bend your wrists down like that? Okay, good. And now wrists up. Good. All right, so one test we're going to do is called Tennell's sign. And I'm just going to hyperextend the wrist and tap right there. Is there any tenderness there? You're just tapping over that medial nerve to see if there's any pain, which can be indicative of carpal tunnel syndrome. So then I'm going to have you put your hands together like this. Yeah, and push them together real hard. Okay, and you can stop, but normally we would have the patient do that for about 60 seconds and see if there's any paresthesia or tingling or numbness or pain that elicits, and that can also be a sign of carpal tunnel syndrome. So we are going to go up to the elbows here, and I'm going to be feeling for that ulnar extensor surface, and I'm going to be feeling for the olecranon, pointy part of the elbow over here, and then the medial and lateral epicondyles, and olecranon, ulnar extensor, medial, lateral epicondyles. Okay, put your arms out like that. Okay, good. And now can you flex them to you? All right, good. Now let me do it. Okay. All right, now I want to go up to the shoulders. So for the shoulders, let's stand up. Oh, show the camera here. So for the, I'm sorry, let me go back to the elbows for a second. So if there was any medial epicondylitis or pain on the inside here, that could be indicative of golfer or baseball's elbow. And if there was any tenderness out here on the lateral side, that could be indicative of tennis elbow, lateral epicondylitis. All right, so onto the shoulders. Again, looking for asymmetry, making sure the shoulders are equal height. Turn right here like this for me. And I'm going to start with the general inspection of the skin, of the bony prominences, His shoulders are equal height. I'm going to start about here at the sternal notch and palpate the sternoclavicular line here until I get to the acromioclavicular joint. And then I'm going to be feeling for the biceps groove, and I am feeling, I can feel right here for the coracoid process, which is the point of the scapula that pokes through here. And then I am also feeling for the supradeltoid bursa, and all of that feels okay, and we would do that on both sides. We can also feel for the tubercle of the humerus right here. All right, so we're gonna do some range of motions. I want you to put your arms straight out like this for me. Okay, good. Now put them behind you, and that should be about 60 degrees, so he's good there. Okay, now can you put, let me do this for you first. Yeah, okay, and this is just to make sure there's no like guarding and that their passive range of motion is good too. So can you put your arm over your shoulder like this? Good, and so that's going to be external rotation of the shoulder. Do the other side. Okay, and then can you put your shoulder backwards, like to the small of your back? Good, other side. Okay, good, so then I'm just going to do that as well and just feel and make sure everything is good. Okay. All right, and then one test we can do for the shoulders is called the empty can test. And this is going to look for supraspinatus strength and if there's any injury with the rotator cuff. So take your arm out like this, like you're holding a drink. Yeah, and then empty the can, turn it upside down. Other way. Good. Do it on the other side. Hold the drink, empty it out. Good. Okay, and there's no tenderness when you do that? Okay, good. All right, so we've done the extension and flexion and internal and external rotation. Put your arms out to your side like this. We're gonna do adduction and abduction. So abduction, and then I want you to take your arm and cross it over like this. Here, just get this way. For abduction, okay. And now this one. Adduction, abduction, good. All right, now I'm going to look at your head and neck. So first we are going to again palpate nodules, swelling, inflammation, anything that's not symmetrical. We can look at the shoulders from behind here. I'm going to put my fingers here right in front of the tragus and have you open your mouth for me. Okay, you can close it. All right, good. And I'm gonna be feeling, move your jaw side to side, like this, like, move this part side to side, like you're chewing on something. Good, okay, and you'll feel for any clicking or anything. And that's for the temporomandibular joint, see if there's any TMJ, any issues there. So then we are going to, I'm gonna have you turn around, buddy. I am going to look at his neck, his C-spine here, and palpate these spinous processes, and we can palpate in between these intervertebral spaces as well. Make sure there's no deformities or nodules or anything, and just that everything is symmetric. And then I'm going to look at the paraspinal muscles, which include the trapezius and the rhomboids. And then we are going to test for jaw range of motion. Open your mouth real wide, and the patient should be able to stick 3 of their fingers vertically in their mouth. You don't have to do that though. Okay, you can close your mouth. All right. And then another thing we can do is kneel down for me on your knees. have your patient turn their head towards the affected side, and this is called Sperling sign. You would not do this if you had an elderly or frail patient though. And it's going to be testing for compression, cervical compression. You're just going to go like that and push down. Is there any pain there?
No, ma'am.
Okay, you could do that on both sides as well, and that's looking for any cervical radiculopathy or any pain. So go ahead and stand up for me. All right, we are going to have you bend your neck backwards for range of motion of the neck. Good. And then bend it forward, chin to chest. Good. Okay, and now try to touch your ear to your shoulder. Leave your shoulder down. There you go. Good. Now this side. Good. Okay. Now I'm just going to move your head around and make sure that everything feels good too. Good. All right. So we are going to move on to the back. Again, with inspection, I am looking to see if his spine looks straight, looking for any any skin abnormalities, the redness and warmth, but also looking for anything that is not symmetric if it's not straight. Looking for any kyphosis, lordosis. Bend over, bend forward for me. And then going up the spine and looking for any scoliosis if the spine is not straight. Stand up. He has that normal S curvature in his spine, so that looks good, and I don't see any deviation of the spine. The spinous processes feel good. There's no tenderness when I do that. And if we wanted to check for a vertebral fracture, we see this a lot whenever we're trying to like clear someone off a backboard, if they've been in an auto accident or something like this. You can take the ulnar surface of your hand and just percuss down. Stand up. And see, is there any tenderness with that? Okay, so now I want you to bend backwards like you're going to do a back bend. Good. And that's greater than 35 degrees, so that's good. Now bend forward, and this should be about 90 degrees. Okay, you can stand up. Now I'm going to take a look at his hips. Again, looking for symmetry and any abnormal skin areas, redness, warmth. So turn this way for me. Actually, you want to lay down? We can do this part while you're laying down.
Okay.
Lay on your back. Stand some. Okay. So I am going to be feeling it on your hips. I'm going to be palpating the the anterior iliac spine, and then the posterior interior iliac spine, and then we are going to feel for the greater trochanter here. You don't have any tenderness there? Okay, good. So one test you can do to test for the back as well is the straight leg raise. So I'm going to take his leg and raise it straight up. Good. And that goes above 45 degrees. So that's good. And if there were any issues with that, that could be like the sciatic nerve running down the back, and that would elicit pain with the straight leg test if there were sciatic issues. Okay, so doing a little bit of passive range of motion here. Okay, now I want you to do that on your own. Lift your leg up. Good job. Other one. Okay, good job. And now can you take your leg and cross it over you like this? Good. All right, other side. Good. And then put your leg out. Spread your leg like this. Good. And back in. Okay. Good. All right. So we are going to move on to the knees, and again, inspecting. I'm going to palpate the suprapatellar pouch and then the sides of the patella. And then I'm going to palpate in the back here for the popliteal fossa area and check for any Baker's cyst. Do you have any tenderness when I do that? No? Okay. All right. I want you to bend your leg up like this. Good. Okay. And now this one. Bend your knee. Good. All right, I am going to do a couple of specialty tests here to check for a couple of things. So the first test I am going to do is the valgus test, and I am going to put my hand on the lateral aspect of the knee, medial ankle here, and push, and that would stress that medial collateral ligament here, and then we would do that on both sides, and then we can do the opposite, which is the varus, and that would be putting stress on the medial collateral ligament. Okay, and then I'm going to do Lockman's test, so I'm just going to take his leg like this and just push and pull, looking for any laxity in that knee. Anything hurt there, buddy? All right, and then the next test is there's Lockman's, and then we are going to the drawer sign, posterior, anterior and posterior drawer. So you're gonna actually sit on the patient's foot, and then you are going to pull and push, and this can look for any anterior cruciate ligament or posterior cruciate ligament tears, and we would do that on both sides. That looks good. One thing I want to do is Thomas's test, and this is for the back, but while he's laying here, this is going to test for any hip flexion contracture issues. So take your knee and pull it to your belly. Good job. Do the other side. Okay, and then we are going to do Faber's or Patrick's test, and I'm going to take his leg, put it over like a 4, and then just push down here. You have any pain when I do that? Mm-hmm. Okay, and that is looking for any diseases or injuries in the iliac spinal area. Okay, you turn on your belly for me real quick, buddy. All right, now push this leg up, like this. Kick it backwards. Good. Okay, down, and then this one. Good. All right, can you roll back on your back though? I need to do one more test. We didn't do McMurray's test here. So for McMurray's test, I'm going to take his leg like this and twist the tibia medially and see if there's any pain with that. No pain with that? Okay. All right, go ahead and come have a seat back up here. All right, so I am going to move on to the legs here and the ankles. So we are going to feel for the malleolus, and we will feel for the medial and lateral condyles. And again, starting with inspection as we're doing everything, looking for any abnormalities, inflammation, nodules. And then we're gonna feel back here, the Achilles, We can go under here at the calcaneus and see if there is any plantar fasciitis signs. And then we are going to do the distal and proximal interphalangeal joints and the tarsals and metatarsals, the bones of the foot here, and feel for those. Metatarsal phalangeal joints in here. And then one thing you can test while you are looking at a patient's foot is you're going to go usually between about the 3rd and 4th digit underneath here and press and see if there's any pain, and that can be caused from something called Morton's neuroma, which is just like an excess growth of tissue that people can get. It can feel like they're stepping on a pebble in their shoe, and with that nerve under there, it can cause pain in these toes and everything. So we are going to do some range of motion with your ankles. I'm going to invert and evert, invert and evert. Can you do that on your own? Point them in and out. Yeah, now turn it here. Good, this one. Okay, good. Okay, and then lift your foot up. We're going to be doing dorsiflexion and plantar flexion. Point your toes. Point. Good. Plantar flexion, dorsiflexion, dorsiflexion, plantar flexion. All right, and I'm looking to see, I would need him standing up for this, but he probably not going to stand up again. There we go. And see if there's any notable flat-footedness. He's got a little bit of an arch there, so that is good to see. So I think that is everything. Let me just do a run through in my brain real quick, make sure we got everything. We did Sperlings, we did the empty can, we did Phalans and Tennel sign. We did the 4 on the lower and the straight leg raise. And I think everything looks good. Stand up real quick for me. One thing I need to do is I would sit while he stood, and then I would have you turn your hips, like rotate to the side, like your legs are stuck in the mud, but you've got to look that way, to the left. Look like this. Tristan, stand up. Look. Like, hold your hips still. Come here. Okay. Now, turn your shoulders. Look like this. See how my hips are still? We're going to go. Okay, turning at the hips. And then I'm going to be feeling on these sacroiliac joints and making sure that they're all stable and good. Turn. Okay, good. Other way. All right, now try to bend forward. Good, now bend back. Okay, and I would be looking to make sure the hips were at an equal height. And then if I could see his buttocks, I would make sure that the gluteal folds were at a symmetric height. And I think that is all. So thank you for being my participant today, Tristan.